I'm honored to introduce our next expert, Dr. Eviatar Matania. Dr. Matania led the Israeli National Cyber Bureau from 2011 to 2015 and was Director General of the Israeli National Cyber Directorate from 2015 to 2017. Dr. Matania is a thought leader in cybersecurity and policy and advises top government officials and leading global companies. With no further ado, please welcome Dr. Eviatar Matania.
Good morning. Why healthcare? Among the people here, one doesn't have to explain why healthcare systems are so important, but the prevalent notion of most people in the cyber world, usually, and in Israel also, is that the energy systems or the financial systems, they are critical infrastructures usually, maybe also transportation. And healthcare systems and the whole healthcare sector is very important. But the prevalent notion of most people is that it is not a critical system. Somehow people believe that the healthcare sector knows how to manage these risks, among other risks that they have. But I find that the healthcare sector should be critical, and I decided to come here to this session because of two reasons. One, because I think that, and I believe, that the healthcare system is very interesting from the point of view that it is interdisciplinary system and a challenging one, and has more sort of systems, of IT systems and cyber systems than any other sector. And it's very challenging and interdisciplinary sector which we should mitigate. The second reason is that looking at the future, we are going to have a new healthcare system. We are under a revolution in the healthcare systems because of, Professor Idman mentioned, the next technologies of IT, next technology of ICT, and the whole artificial intelligence which is entering into the healthcare systems. So, in the very current future, it will not be just that medical centers are vulnerable to cyber attacks. Our homes, through IoT systems and through telemedicines, are going to be connected into the healthcare systems. And not only our homes. We are going to be connected because there will be a lot of wearables in the healthcare system and implants connected to cyberspace. So people, their homes, their lives, and the whole medical center of the healthcare system are going to be one very large healthcare system, and it's going to be critical. And that's why it's so interesting for the interdisciplinary point of view. You will not find any other sector which has such a big challenge. IT systems, SCADA systems, all the MRIs, CTs, other systems, embedded systems, connected systems, and telemedicine and IoT, which are currently under development, and you know, it's just in the beginning. We are going to be there in 5 years, totally connected to our homes, not just our mobiles, and wearables and implants. Implants here, implants here. for diabetes, for everything. They are going to be connected. Dick Cheney, who was the vice president of the US and had an implant inside his heart, asked it not to be connected so he will not be vulnerable to cyber attacks. So think about it. How big it's going to be, interdisciplinary, and there are very few people who know to deal with IT, systems, IoT, and wearables. Most of the time you don't find such people. And this is a challenge of the healthcare systems. And if you looked at the challenges, the full scope of threats, there will be criminals, hackers, terror organizations, nation states. Each and every one of them will find a reason why to attack healthcare systems. Currently, I can tell you, it is less attacked than other sectors. Although you find a lot of attacks around the world, and it was mentioned here, and again, with this audience, I don't have to repeat why it's so important. The financial sector is currently much more attacked. But looking at the future, everyone will have its reason. Criminals, terror organizations, they will want to aim towards specific persons or specific community. There will be competition among companies and, of course, nation states. Total connectivity. This is a system which is connected, but totally connected. You know, sometimes you can say, oh, the military has also the same challenges, systems, IT, everything, but it is not so connected as the healthcare systems, where medical centers should be connected to doctors, to their homes, and patients are going to be connected with wearables, implants in their houses, and the whole healthcare systems between medical centers, and the system and the billing and everything, it is well connected. And not just that, it's an open environment. Again, when I give this talk not to the audience which has something to do with the healthcare system, just go to a hospital and see how many people are there. It's not a military base where only few people may enter. Everyone is there, patients and doctors and their visitors and families, and everyone is there. It's an open environment, and patients, they go and will go with their wearables and implants along the hospital and in their houses. It's an open environment and totally connected. And our challenge is to the whole, what we call the CIA, confidentiality, integrity, and availability, and just name the second sector which has all these objectives. There is no one. Usually, everyone has to keep all these, but usually there are sectors which mostly care about integrity, or those who care about confidentiality, or the energy system, for example, availability. Take, for example, the IT of government. Availability. It has so many problems, it doesn't work even without cyber attacks. Availability is not so important. But in medical centers, in the healthcare systems, or where we are talking about integrity, the integrity of the data, that it will not be abused or changed, the micrograms or other things, there is no other sector with so big importance to all these three. This is challenging. So that's why I believe that it is interdisciplinary, it is challenging, and just add to this three very interesting points. First, constraints. Regulation and liability. If you want, for example, just to build or develop or buy, purchase, or maybe put some new cyber systems in your medical systems. Oh, GE or Philips or other will not let you do it, because who is going to be responsible for the usability of the systems? What will be about who is going to be liable? So there are a lot of regulations, both of the national level and the companies that sell this, that don't let you do whatever you need to. This is a global problem. Think about, for example, our aircraft company, El Al. Think about if Boeing didn't let them do what they needed in order to have more physical security in the airplanes. It couldn't exist. What currently happens in the healthcare system, that we are under tough regulation and liability problems that don't allow us to do what we need to do with the systems. And then the case of medical systems R&D. There are a lot of new developments and research in the healthcare system. If you go to these companies, you can find their very gifted, high-end physicists and computer scientists and other people. They know their job, but usually they are so concentrated in the new frontiers of medical systems and healthcare, they do not have the same concentration and focus on the cyber issue. Most current and even future medical devices are not developed under design of cybersecurity, because most of the efforts and most of the budgets and energy of the gifted developers go to mitigate the frontiers of the systems and not focusing on the cyber problem. And we need that the whole design will be different. The healthcare systems should be cyber designed. Currently they are not. And something which is very interesting in the healthcare systems is that it deals daily with life and death. When you go and help for example, a train company, or you need to cyber secure vehicles, usually you do not expect that people will be killed. You're doing it in order to save people's life. But the healthcare systems, it has a daily struggle about people have infections, other problems. Cyber is only one among them all. So it's a system which deals with life of people every day, and the way it's going to consider how to put the cyber risk inside is different the other sector. The energy sector doesn't deal with daily with the life of people. The same as the financial sector or the transportation, but the healthcare, yes. So they need a different way of how to consider, how to weight the cyber issue inside the systems. I tried here to put some classification of why the healthcare systems is much more important and critical than most of people outside this room think, why it's going to be even more critical in the future, and the classification of the problem and the challenges. The question is what to do. This is quite a short time to tell exactly what should be done, but I want to try and draw the trajectory of what we need to do, and I divide it into 3 levels. The first one is the healthcare system, the providers themselves. We should first build a dedicated unit in order to mitigate cyber risk. It couldn't be under the IT people. The IT managers cannot really cope with the cyber risk because it's much more than inside the IT systems, and it should be a dedicated unit. The same way that you don't expect that the security officer of the building should report to the housekeeper or to the manager of the building, but reports to the CEO, the same should be when you really understand what is needed in the cyber systems. The cyber defenders cannot report to the IT managers. They have different ideas, different focus, and it should be a dedicated unit reporting directly to the CEO or to some VP of the healthcare provider. Embedded mindset. Behind each and every attack, there is someone. It could be a hacker, criminal, crime organization, terror organization. It's not just security. It is defense. We should have an embedded mindset in order to understand this dedicated unit, that it should change the way it works every day. New systems, there are new vulnerabilities, new threats. It's not just to put walls, some firewalls, or new developments inside our systems. It will not end with it. It should be dedicated daily to understand that it is a battle, and you should have a battle mindset and be ready for crisis. Crisis will happen. It happened through WannaCry just a year ago, something like a year ago, mostly in the United Kingdom, but around the world. Crisis will happen. And hospitals, healthcare providers, medical centers should be prepared to manage crisis. And manage cyber crisis is not what most people think, how to manage your IT or your computerized systems. Is how to manage your customer, the patients, the doctors, the regulators, the media. And in parallel, what to do with your computerized systems. Crisis will happen. The more prepared we are to this crisis, we will be able to overcome it. The sectoral level should pay attention mostly to 2 issues. One, emergency training. How to train the whole system to emergency when it happens. Cyber emergency can happen through another problem for emergency, a war, but can also happen because of, for example, a new WannaCry. This should be trained. And sectoral cert. Sectoral cert, which works with the whole healthcare system, is important, and the sector in each and every country should establish such a cert with expertise in healthcare systems, in medical devices, in vulnerability of healthcare systems. It's not the same as the financial one, and it has a specific cert, or the energy sector. Going to the national or the global level, I believe that 2 issues are very important. One is trying to remove all the constraints, and the constraints, I mean the regulation problem of the big global companies that are responsible for all the medical systems and other problems of regulations, in order that we will be able to change, replace systems, to put the new cyber secured developments. Otherwise, we will not really be able to change the whole issue of cybersecurity. working with current medical systems and with those who are currently developed, all the wearables and implants and all the telemedicine, and working with them according to what the developers are putting there will not be enough for the real cybersecurity that we need. We need then to remove the constraints of liability and regulation and be able to provide them with the new cyber security productions and solutions, which the pace of the change is the pace of change of cybersecurity systems is not the same as the pace of change of healthcare systems. That's why we cannot rely on the solutions that the providers and developers of the healthcare systems put them when they develop them. And a global center. I believe that there is a need in a global center. Professor Edelman, you're going to be a world leader, and a global center that work with all the national certs and put inside expertise to help developers of medical systems, medical centers, walking around the world to understand the vulnerabilities, trying to really remove constraints, building a real sharing of information and some partnership between the global developers of medical systems and their customers is very important in order to remove constraints and to help the whole system to really be ready and prepared for the next generation of threats on the healthcare systems. So just to sum up, what I tried to put here is a perspective that comes not from the physician point of view or from the medical center point of view, but from a more comprehensive cyber point of view, trying to explain that from my point of view, the healthcare systems is going to be one of the most critical ones, challenging because of the systems, wearables, implants, houses, telemedicine, and the IT, and the trajectory which we should follow is a parallel work inside the providers, through the sectors, and with the national and global level to remove constraints, to understand that there will be crisis, and to have dedicated units with embedded mindset to deal with this threat. Otherwise, we will find that we will be in a crisis with a lot of panic and problems, and will not be able to overcome it. Thank you.